Good afternoon, everyone. Myself, Mr. Siddharth Nakhwa from the Department of Biochemistry, KJ Somaya College of Science and Commerce. A warm welcome to one and all for the annual departmental festival Svaasthy Mahotsav 2021-22, organized by the Department of Biochemistry, KJ Somaya College of Science and Commerce. Let's start our session by following the Indian tradition and reciting our Somaya campus prayer. I request Dr. Hina Shah to kindly play the prayer. Thank you so much, ma'am.
Thank you so much, ma'am.
Now, I call upon Dr. Ketan Ranade about the Svaasthy Mahotsav.
All about the Svaasthy Mahotsav.
Good afternoon, everyone. Once again, welcome for this session of Svaasthy Mahotsav. I once again welcome you all on behalf of Department of Biochemistry, my HOD, Dr. Samida Pavaskar, and my principal, Dr. Pradnya Prabhu. I welcome you all once again for the session. As you all know, Svaasthy Mahotsav, as briefed by Hina ma'am last time, this Mahotsav is Svaasthy Mahotsav is we carry it since departmental festival since 2014, and this idea was conceptualized and implemented by our HOD, Dr. Sameda Pavaskar. Actually, this event, when I talk about this event, see, you all must be aware that getting doctors on one platform, it is really very difficult. Means getting their appointments because they are busy too busy and getting their appointments, and sometimes it happens that you are not you're not clear of your mind to ask all of your questions to the doctors. So this is the best platform made available for all of you, so that you can get knowledge from these eminent doctors and you can ask your questions to them also. So this is the platform available made for you all to interact with the eminent doctors, as we call all the eminent doctors from all the streams to this event. So I welcome once you again to everyone, and over to you, Siddharth.
Thank you so much, sir. Now let us take the event further, and for it, I would like to call upon Ms. Asta Vyas to introduce our first speaker for the day.
Good afternoon, everyone. Our first speaker of the day, Dr. Chetan Manohar Ved Pathak, is a Ayurvedic consultant and practitioner since year 2000 and works at 5 different locations in Mumbai that are Charni Road, Chembur, Dadar, Mulund, and Vileparle. He accomplished his bachelor's of Ayurvedic medicine and surgery from year 1995 to 1999 from Yerala Ayurvedic Medical College, Kharghar, Navi Mumbai. He did his postgraduate diploma in clinical data management from Krima, Mumbai in the year 2008. In year 2014-15, Dr. Chetan achieved diploma in personal counseling and REPT training from Heart to Heart Institute, Bhaikala, under the guidance of Dr. Meenu Bhosle. And since then, he has been counselor and corporate mentor and has counseled number of patients. Over to you, sir.
Am I audible?
Yes, sir.
Thank you so much. Thanks for this brief and very crisp introduction. So I feel honored and I'm happy for the opportunity given to me to talk in this Svaasthy Mahotsav about this wonderful science of Ayurveda, which has actually stood firm in these changing times and still continues to guide us and the entire mankind to ultimate goal of complete health. I guess this is my 6th or 7th year in a row that I have been invited to Svaasthy Mahotsav, and I hope I feel extremely humbled. I feel extremely happy that my science continues to guide us all and everybody. And today, even when the entire world is fearful and worried about COVID-19, the purpose of Ayurveda, Swasthasya Swasthya Rakshanam, Aturasya Vikara Prashamanam cha, gets highlighted as it means that prevention is better than cure. It is said that the word Ayurved has got derived from 2 words, Ayu and Veda. So Ayu means Ayusha, Ayusha means life, and Veda has got derived from the dhatu named as Veda Vida, means to know. So in simpler words, Ayurveda means knowing your own self, knowing your own composition, knowing your own body, and knowing the unique qualities of your body. So for example, 2 children which are born to a same mother possess different physical mental characteristics like height, skin color, hair, eyes, nails, etc. They're all different, and also their response, their allergies, their food to a response to their food, whether is different even though born to a same mother. This unique personality, Ayurveda believes that each individual has its own unique personality. So hence, in the case of disease, that is dis-ease, where you're not at ease with yourself, or rog, according to Ayurveda, the management of the same is going to be different. Everybody needs a different management. Everybody needs a different treatment. So let's go back to the word Ved, Vida. It takes us to ancient source of knowledge, which is Ved. So there are four basic scripts of Ved: Rigved, Atharvaved, Yajurved, and Samaved. Each Ved has various topics which are discussed and elaborated. And on those topics, they are all formatted in the form of shlokas, which are known as Richa. Atharva Ved is a part of Ved where they have discussed health and various other medicines. Hence, Ayurveda is known as Upaved or branch of Atharva Ved. Ayurveda is closely related to Hindu Dharma, and hence there are a lot of deities and gods which are mentioned into Hindu Dharma, which is believed in following concept, and Hindu Dharma believes in following concepts of Punarjanma, which is reincarnation, Gata Janma, that is past life, Paschata Janma, that is afterlife, Karma means action, which are passed on from one life to another. And hence, it's very important that they believe that the life force in our body, or the living force in our body, in every living thing, was called upon as Atma or soul. So it talks about purpose of every human being attaining moksha or keval gyan or nirvana. So Ayurveda, as believed, was brought to this globe for the betterment of all the human beings and all the living things by Lord Dhanvantari, while Samudra Manthan was being performed on the auspicious day of Dhanatrayadashi, which is commonly known as Dhanteras. So to attain this moksha, one needs to be in the best of his physical, mental, emotional, and spiritual health. So they defined the definition of a healthy human being as samadoshaha samagnisha, samadhatu malakriyaha, prasanna atmendriya manaha, swastha ityabhidhiyate. So I take, as an Ayurvedic practitioner, I take immense pride and privilege to tell you that definition of a healthy human being was accepted by WHO few decades before, where they incorporated concept of happiness of soul into it, wherein Ayurveda has already described a healthy human being as a person who is going to be happy and healthy on the physical, mental, emotional, and spiritual level. So when can you say that a human being is healthy? That's when he continues to live a happy and contented life on physical, mental, emotional, and spiritual levels. So we shall talk all these points in brief. So it will clear few concepts of total and complete health to you all. So when can you say that a human being is healthy? Is it something where you say that it is related to an ideal body weight or ideal BMI or six-pack abs or zero figure? The answer is when a person, an answer according to Ayurveda is that when a person has a sleep enough to make him get up fresh, he's able to get hungry on specific intervals, he or she is able to eat in adequate quantity and digest that food and feels empowered with the food what is being eaten, he or she is able to pass the unwanted food via feces, urine, and sweat. That person is termed as healthy. So Ayurveda is a science which is based on concepts of dosha, dhatu, mala. So it is considered that our body is based on the tripod of vata, pitta, kapha. So vat constitutes with the gaseous concept, pitta constitutes with a heat concept, and kapha is a stability concept of our body. So it is said that human body is 70% water, but we are not in a liquid state. We have certain shape, we have density. So it is all due to the kapha dosha in our body that we have a structure, we have our limbs, we have our face, we have our bones, This is all due to kapha. The vayu is responsible for all the actions in our body, which is digestion, defecation, sweating, even blinking of our eyelids is based with vayu. And pitta is considered with the digestion. So we can't eat the whole grain. The grain needs to be, it needs to get into different forms, and only then our body is able to digest. So the digestive system or the digestive power is related to pitta. So vata, pitta, kapha, these three doshas, when in a state of equilibrium, the person is known as swasthya. And the time when this equilibrium is disturbed is a time when we say that a person has got vyadhigrasta, or there is a presence of roga in the body. So these vitiated doshas amalgam of themselves along with 7 dhatus in our body, and because of which these dhatus get vitiated, and we have the system or a condition which is known as roga. And Ayurveda believes that every disease needs to be managed specifically according to your prakriti, according to your basic composition. So when we talk about a healthy lifestyle, the lifestyle revolves around our food, our daily habits, which are written down in Ayurveda in the column of Dinacharya. We have different rutu, or different time zones, different times when the atmospheric changes are experienced. They are known as rutu. So we have specific rutucharya, which are mentioned in our text, which help to make sure that the balance of vata, pitta, kapha is maintained, and we do not get any kind of diseases. When I started with my session, I mentioned the purpose of Ayurveda, which is swasthasya swasthya rakshanam and aturasya vikara prashamanam cha. You know, even the lecture series what you have today is known as Svaasthy Mahotsav, where Ayurveda talks a lot about prevention aspect. And for past 2 years, thanks to COVID, that everybody is home, and today the vaccines or the quarantine process, when a patient is getting diseased or getting affected with COVID, these are nothing but swasthasya swasthya rakshanam. So we highlight a lot on preventive aspect rather than treating the roga or treating the disease, because we feel that if a person is healthy and disease free, and if he continues to remain into disease free condition, he will have a better longevity and better quality of life. So it depends on your food. So when we speak about dinacharya, the daily schedule, what Ayurveda believes that everybody should follow, it talks a lot about the food which needs to be eaten at a specific time, the quantity at which it needs to be eaten. It talks a lot about exercises. It talks a lot about water. It talks a lot about sleep. And when we live in metro cities, now Ayurveda was evolved around 2500 to 3000 years before. At that point of time, the lifestyle what we live in today is entirely different. So they spoke about getting up before the sunrise, exercising to a level where your armpits, where your forehead and your body starts sweating. It talks about eating only when you are hungry. So this concept or these concepts of dietetics have been spoken a lot at this point of time with respect to Dikshit diet or intermittent fasting. So Ayurveda believes a lot that you need to eat only when you're hungry rather than looking at the clock or eating regularly after intermittent times. So basically, there are many concepts in Ayurveda which have been discussed at length in Dinacharya and Rutucharya. So according to Ayurveda, there are 6 seasons in a year, and every season has different characteristics which actually vitiates each dosha in our body, and that dosha initiates different diseases in our body. So they have mentioned certain food and they have mentioned certain medicines which needs to be taken so that we do not contract diseases which are borne by these different atmospheric changes. So as to say that we had Makar Sankranti few days before, where we eat til and jaggery, which is considered to give lot of warmth and lot of urja to our body, which Shishir Rutu has made sure that your skin turns extremely dry. So the sesame seeds or the til seeds and the good will give you that urja and give you that warmth to make sure that your skin doesn't go dry. So these are the very smaller examples which I've mentioned to make sure that you guys understand that Ayurveda talks a lot about dietetics. It talks a lot about Rutu. It talks about daily routine, because the ultimate aim of a human life is to attain moksha. It talks about the purpose of the human life to attain moksha. And Ayurveda has accepted different thought processes while concreting the concepts of Ayurveda. So it has accepted the concept of yoga, which is Ashtanga Yoga, which talks about yam, niyam, asan, pranayam, pratyahar, dhyana, dharana, and samadhi. So when you attain the state of samadhi, and you're going to be in that state of samadhi for months together or days together, and if you are not going to be healthy, where your body is not acclimatized or tuned to make sure that you can sit or you can pray for that period of time to attain the Keval Gyan, you can't actually attain moksha. You don't have a purpose then. And because of which it talks about getting healthy each day and to follow the patterns of dinacharya and rutucharya to make sure that your life is disease free. In my practice of past 21 years, I have been practicing pure Ayurvedic medicine. I have screened so many patients where just by merely changing the lifestyles and merely getting them tuned to the atmospheric changes and getting them acclimatized with the atmospheric changes and your daily routine, you see lot many signs and symptoms of the diseases perish without taking any medicines. So giving you an example of a hyperacidity, which is a very common phenomenon these days with people, because of wrong dietetics, because of erratic timings of eating, because of different timings of sleeping, people work in different time zones, and that leads to hyperacidity. And when certain changes in their daily routine are recommended, it is observed that within few days, the hyperacidity settles down on its own. We have certain food items available in our household, which is commonly practiced, like zira, hing, ajwain, dhania. These are, though they have medicinal properties, it is widely used in every household in India, which are the basic source of medicines which are getting into your body on daily basis, which are making it sure that you don't have doshas getting vitiated to another level where your body starts representing signs of disease. So if we go back in March 2020, where COVID engulfed the entire world, Ayush Ministry had prescribed this Ayush Kwat, which had all the masalas which are commonly used at our household, like long, ajwain, star anise, dalchini, cardamom. These are the spices which were told to take in certain quantity, in certain amount, and a decoction made of these medicines help people to make sure that they don't develop cough or any other signs which is associated with COVID-19. Uh, with very simple and basic household things, you can make sure that you can keep your diseases at bay. Even along with these household medicines, even certain things every day can make a great deal of difference in your health, such as exercises, such as drinking adequate amount of water. So many a times patients come to my clinic with lot of questions in their mind about intermittent fasting or about water therapy or the hydrotherapy, where a patient needs to drink around 1.5 liters of water on an empty stomach, which makes sure that their bowels are clean and they have better digestive systems. But when you read the texts of Ayurveda, and when you understand that basically this system is not really uh, good for our Indian system, and where we have seen that it induces a lot of hyperacidity, it induces a lot of acne or pimple, so as to say, in younger generations, though it helps to clean the bowels. So Ayurveda, being the science of India, talks something where we all can follow something which is locally produced, something which you can have locally, and you don't have to make too many different changes in your lifestyle and too many different changes in your eating habits. So now there is a lot of discussion about the vegan diet, the gluten-free diet. Well, it holds true in certain cases, but people at large, even today, are can remain healthy with roti, sabzi, dal, chawal, where rice is introduced to the child at a very early age, say by 6th month or 7th month. And we have in Ayurveda, there is a vidhi named as Annaprashan vidhi, where a child is made to eat rice or rice kanji, and that's how his digestive system start getting tuned to different various food. So basically, Ayurveda overall has thought about every aspect of human life, and it is going to put you onto a path of a healthy life, which is healthy not only for you but for your family and for the entire mankind. It talks just not about the longevity, but it talks even about the quality of life, because it believes that when your body, your mind, your soul, and your spirit is in sync with each other, and it is at the level of happiness, only then you can attain total health. Thank you so much.
Thank you, sir.
Yes, there are a few questions.
Yes, sir. We would
Yes.
like to call. Now, I would like to call upon Dr. Saima Khan to please continue with the question and answer session.
Yes, so there
Thanks
is
a lot,
one
sir.
method.
It was a wonderful,
Um,
informative session. Let us look into the questions.
yeah.
So the
So first
first
question
question
is,
is acne only dependent on hormones, or there are other factors playing a cause in causing acne?
no, there are other cause also. In my practice, other than changes in the hormones, there are other factors like your digestive system. Lot many times even it is related to your skin type. It is related the way you sweat. It is related to pitta dosh on an average, where you see that when the pitta dosh gets vitiated, and it actually manifests on the skin surface, you have acne and pimples. And mind you, acne and pimples are not only on your face, but I have seen that acne and pimple are even on your back, on your stomach, on other parts of the body. So it has to do a lot with your pitta dosh.
Okay. Okay. So there's another question with respect to what does the changes in dinner or lunchtime can leads to disease, and
Yes.
whether they're supposed to have water on empty stomach in the morning.
Yes. Very interesting question when it comes to timings in dinner and lunch. So I have a lot of patients who are working for US timings, and their timings are either say 11 to 7 or 2:30 to 3:30 in the afternoon to 2:30, or it is the night shifts what a lot of people go in for. And these people have constant belching, or they have gastritis or incomplete bowels, and they feel gassy all the time. This happens because we believe that the strotasas or the systems which are there in our body, they tend to actually shut down after the sunset. And people who have their night jobs tend to eat, say, by 1 o'clock or 2 o'clock in the night, or they generally have a lot many cups of tea or coffee, which is going to actually not get absorbed or not get digested well. And this apachit ahar, what we call it as, leads to amadosh. And this amadosh can contribute to gastritis, it can contribute to constipation, it can contribute to headaches, the migraine, it can contribute to fatigue, it can contribute to even for mood swings. So if you really want to follow a healthy lifestyle, a very light dinner and a lunch on time, that is by noon or by 1 o'clock, is something what we recommend.
Okay.
Yeah. Yeah, you are not supposed to have water on an empty stomach in the morning. You can have water on an empty stomach in the morning. Please consume warm water on an empty stomach, and do not consume a liter or a half, or it is considered that bhukhe pet pe ek lota pani pina chahiye. Well, it is not recommended because it can lead to a lot of belching and it can lead to gastritis over a period of time.
So there's another question. Does sleeping very late causes diseases? I think that's it.
Oh, yes, it does. Again, anything which is not in tune with dinacharya is going to show up on your digestive system first. Number one, what you see is hair loss. Lot many times it manifests itself with acute hair loss. It manifests itself with acute headaches, mood swings. Also, it manifests into, sorry. Yeah, it manifests itself with changes in your digestive system, where your digestive system turns dull and it's not able to digest the entire food. So you don't get the feeling of hunger and you're not able to digest the food well.
So how to combat pitta dosha?
Yeah, so pitta dosha is a heat component in your body. So when you feel that your heat component is going up in the body, so you can incorporate something which is soothing to your body. So when it comes to food, it is about vegetables which are high on water, such as dudhi, galka, tori. These are the bhopla. Okay, these are the vegetables which we generally recommend our patients. We try and tell our patients to avoid very spicy food, garam masala, green chilies, in specific Chinese food, which is half cooked and which is just saute food, and it has got lot many spices and lot many those vinegar and soy sauce, which are very pitta dosh बढ़ाने वाली चीजें हैं. So you're not supposed to eat them, and this is how the heat component in your body comes down. Also, it is recommended dhania or zire ka pani or the chia seeds nowadays, ya to sabja, which is actually advised to combat the pitta dosha.
So there's a question: what is the cure for prolonged acid reflux problem? And somebody is having the Ayurvedic treatment for 1 year, but still there is stomach pain and bloating during midnight.
Yes. Now, this is a very specific question. What I guess Shruti has asked this question, right?
Yes.
Now, yes, the acid reflux. Acid reflux is a phenomenon where the acid is coming up, which according to Ayurveda is urdhva vayu. So when your vayu is pushing your pitta to go upwards, is a time when you will have acid reflux. We have seen that in cases with acid reflux, having small quantity of food works very well. Number one. Number second, in Ayurveda, they have said that you have to consider your stomach and as a bag, and divide it into three parts. So first part is for the food, the second part is for the second part is for the fluids, and third part is for the gases or the gaseous component. उसको खाली छोड़ना है, ऐसा उन्होंने बताया है, so that that vayu is not going to vitiate your pitta and it's not going to come up. Okay, even this patient is facing the problems like stomach pain and bloating. It might come down with eating in limited quantities. So we recommend our patients at the moment you have the first burp while you're eating, stop your food, try and conclude your food, which will make sure that the bloating will come down and even the reflux will eventually come down. Certain medicines like Kamadudha or Dadimavaleha are very effective with reflux, and she can take these medicines with a consulting doctor, and I'm sure she can actually win over this GRDI.
Yes. So this question, does chest pain can be due to acidity or any remedies for? If yes, then what will be the remedies?
Yes, not many times a patient represents as a pain in chest and they feel that they have got a myocardial infarction or heart attack in our local language, but many a times it is to do with gastritis, because there's an inflammation to your stomach and that inflammation is pushing the part of because of the diaphragm. The diaphragm gets pushed and you have discomfort in your chest. So there are good medicines in Ayurveda for such kind of hyperacidity, like Kamadudha, like Gulkanda. And if you don't want to take any medicines, anar, which is darim, okay, or laja manda, that is जो कुरमुरे होते हैं, मुरमुरे होते हैं, उसका पानी, it is considered to be very, very soothing, and it can relieve from these kind of chest pains and attacks of gastritis.
Saima,
There is, I guess, there is one more message which has got lost, is does Ayurveda allow non-veg diet? Yes, it does allow non-veg diet. It does talk about non-veg food. There are various medicines in Ayurveda which has got non-vegetarian items added. So we do not say that Ayurveda means vegetarianism.
Okay. Dr. Ved Pathak, this is Samita Pavaskar.
Namaskar.
Namaskar. Nice to have you once again, and nice to see you after a long time.
Yes,
I was patiently listening to you, but I just wanted to intervene because you were answering one question, just this question, the earlier question on gases, okay, gases and the season, okay. What I would like to share with you, we had taken whatever you are talking about dinacharya and rutucharya. I wanted my students to understand and find out the correlation between this modern science and Ayurveda. And we have discussed a lot on this, where my students presented and we had discussion, and we are really fortunate that we are having you now and you are talking on the same thing. Okay. Now, to what you have added, what you have already added, I just want to ask one thing. There was a question on gas formation, and you are talking about, use of pomegranate, and how these gases are related to heart disorders. I would like you to add also on this particular season, because if you see, usually this winter season, we have a lot of heart problems, lot of news where people are losing life because of heart attack. We have news on the TV, aaj ye gaya, wo gaya. So why this gas? I mean, is it a seasonal that the gases become more in this winter season?
Yes, yes, they do get more.
Yeah. So exactly, I mean, how you feel that how we should tackle this winter season, especially to focus on the acidity problems and gas problems together.
Yeah, so winter actually is Hemanta and Shishira Rutu, what they say. And Hemanta and Shishir Rutu are predominantly dry seasons of the year. Now, they have mentioned that Hemanta Rutu and Shishir Rutu where ठंडी हवा चलती है, वो हवा आपके शरीर को सुखा देती है, and because of which it is considered that your skin, the pores of your skin generally close themselves down, and all the heat inside your body gets trapped. So a lot of people experience gastritis or acidity problem or gas problem in this season because there is a lot of heat trapped in your body. And that's why if you see that it is advised to perform a lot of exercises during this season. It is said that the arm, which is apachit ahar ras, which is the byproduct of the sluggish digestive system, can be combated with warm water. So it is said that you are supposed to have warm water throughout the day. You are supposed to have soont in this season, which is dry ginger powder, which is very good against the ama dosh, which is going to make sure that the pitta dosh is going to settle down. It is also recommended that you need to eat after regular intervals, and you need to make sure that addition of something which is not going to push pitta dosha in your body is something which is recommended. So a light diet, vegetables with high content of water and which are soothing for your body, make sure that you don't get into this bout of hyperacidity.
Saima, you can continue.
Yes, sir. Yes. Okay. So there's a question: can having soya on daily basis boost the estrogen level?
Well, it is a very, very specific question. Okay. Again, having soya on daily basis is Ayurveda has a concept of yog, ayog, mithya yog, and ati yog and vishama yog. So anything what you consume in a moderate quantity is known as yog. Ayog is something what you need to consume, but if you are not consuming it at all, is considered to be ayog. Things which are not to be consumed in a particular season, but if you still continue to consume them, is known as mithya yoga. And when you consume them, something which is beyond the optimum level is known as ati yoga. In this case, even though soya promotes estrogen secretion, if you are going to consume it on a daily basis, it can get into ati yoga, and you could have the side effects of ati yoga in different forms.
So there's question regarding kidney stones, and they are asking, her mother is suffering from kidney stones. She's asking, according to Ayurveda, what is supposed to be done regarding?
Again, kidney stones is a one area where Ayurvedic medicines have worked wonders. So many times when a surgeon says that you have to go ahead with a surgery, we have seen that even 6 mm and 7 mm urine stone has come out. But mind you, it has to be a calcium oxalate stone. Ayurvedic medicines have not shown good results with calcium carbonate stones. So yeah, carbonate stones, Ayurveda has not been so effective. Also, it is being observed that scarring of the tissue can be brought down to minimum with Ayurvedic medicines. So I would recommend, I guess it's Nidhi who's asked this question, to contact any eminent or competent Ayurvedic doctor who can, after carefully looking at the reports and the condition of the patient, can recommend certain medicines. But to name few, something which is there at your house is kulthi, which is known as kulit in Marathi. This is a grain which is commonly used in Konkan area of Maharashtra, and this is considered to be one very effective medicine against the kidney stones, where the stone gets expelled out of your kidneys. There is also one medicine named as Pashana Bhed. Again, as the word suggests, Pashana Bhed. So Pashan is a stone, and Bhed means to crush that stone. So that medicine also works very well.
Okay.
Yeah. There is one very interesting question. Is there a connection between prolonged acidity and asthma? Yes, certainly. Because asthma, though gets manifested by your breathing and lungs, according to Ayurveda, the root cause of asthma lies in your digestive system. So if your digestive system is clear, the asthma can be successfully managed.
Good afternoon, doctor.
Yes, good afternoon.
I have two questions with me.
Yes.
First is on migraine.
Yes.
Means can migraine be treated through Ayurveda, and or rather,
Yes.
if not, then what are the methods to curb the pain of that particular disease?
Right. You can treat migraine very, very successfully, and you can cure migraine, not just treat over a period of time. If a patient is given proper treatment, proper dietary restrictions, and very important is that even 2,500 years before, they have mentioned certain remedies which are effective even in today's time. So, they have mentioned that a patient of a migraine needs to consume jalebi on an empty stomach, and he has to consume a cup of warm milk on top of it. And trust me, I've used it in number of patients, and say a success ratio of headache coming down was around 60 to 70%. So symptomatic relief was attained, and over a period of time, the patient was free from the symptoms, and we were able to make patient comfortable, and even the degree of pain and the episodes and the frequency came down considerably, and patient was very comfortable.
So, doctor, whenever the migraine attack comes, that time they need to consume jalebi and warm milk, or they daily should have it to avoid it?
No, it is considered that it is told that this needs to be done for 3 days in a row, and it needs to be done. It needs to be done when you have episodes of headache happening.
And I have another question. It is related with keloids.
Okay.
Means keloids on arms. So how means these keloids can be removed or can be treated with a.
Unfortunately, keloids do not get treated. Even after the surgical intervention, the keloids do come back.
Okay, doctor. Thank you.
Yeah.
So there are a few more questions. There's one question. Does
I want to answer one question, which is very interesting question. Does Ayurvedic medicines contain steroids? Yeah, it's a very good question, because this is a very common myth in people at large, that Ayurvedic medicines actually has effect on your kidneys. Your kidneys get hampered, and their functioning gets hampered. And Ayurvedic medicines have a lot of steroids in them. Well, it is my advice to everybody who's inclined to take Ayurvedic treatment is to go and meet an authentic Ayurvedic doctor. And please ask for the prescription of the medicines what you are consuming. Lot many times a general practice in Ayurveda is that the doctor gives you certain tablets or certain powders, and you're expected to have that, and you can't question the doctor. I urge you all to question your doctor and to know what are the medicines you're consuming, and you have full right to ask this to the doctor. And please buy all the medicines which are GMP certified and which are from authentic pharmacy.
Okay.
So lot many times you do have phytosteroids in Ayurvedic medicines, but they do not pose any threat to our body.
Yeah.
There is one more question. It is about Sadhguru. That I have heard that he used to sleep only 2.5 hours. So my question is it possible to control your body in such a way? Yes, it is. You can control your body. And I mentioned that Ayurveda has accepted different darshanas or different darshan in Ayurveda darshan, and one of them is yoga. And yoga talks about Ashtanga yoga, which is yam, niyam, asan, pranayam, pratyahar, dhyana, dharana, samadhi. So when you want to attain this samadhi state, so dhyana, dharana, these are the states when you can control your body, you can control your hunger, you can control your sleep, you can control a lot many things. And that is where as his name is Sadguru, he knows the technique to control his own body, and we all can go to that level.
There is a question on osteoporosis.
Yes.
Just now, there is a question on osteoporosis. What is the medicine in Ayurveda on osteoporosis?
Well, osteoporosis, if considered with respect to Ayurveda, the Vayu dosh in your body goes and starts actually, it starts taking out calcium from your bones. It starts growing into your bone, and that's how the structure gets eroded, and that's how the calcium is lost from your body. So lot many times there are medicines which are for asthi dhatu in your body, to increase the asthi dhatu in your body or strengthen the asthi dhatu in your body. And the best medicine, what they have mentioned is Kukutandatva Bhasma, which is the Bhasma of the eggshell.
Okay.
Okay. There are certain other herbal medicines also, which are considered to be very effective against the osteoporosis. One is Laksha, which is Lakh, and second one is Babul Ka Gond. And these medicines, I have personally used them in my practice, and we have got excellent results against osteoporosis.
Okay. There is one question. I think two questions I could see there. One is on obesity, how you can control the obesity using Ayurveda, and somebody else is asking exactly opposite, how to gain weight with Ayurveda. So I think,
yes.
Can you change?
I will
that
like
means
to
the
answer.
question is on the weight gain or losing weight, something with
No,
Ayurveda.
but I would like to talk about both weight gain and weight, a krusha body and a sthula body. Okay, a person who's thin or lean, and a person who's fat or obese. This generally happens because of santarpan and apatarpan. That is when you consume more than what you are expected to consume, and sometimes when you consume less than what you are supposed to consume, you get into these kind of symptoms. And it's said that in obesity, use of till oil can be very effective. Use of masalas can be very effective. In someone who wants to gain weight, oil massages can work very well. Consumption of ghee can work very well with such patients, and it is observed that patients who are very thin and frail, use of cow ghee has worked wonders with them, where not just the weight has gone up, but even their immunity has increased to another level.
And reduction of weight.
A reduction of weight, where to be very precise, there are certain medicines in Ayurveda like Kumbhi or Vrukshamla, which are considered to be something which can arrest the fat gain, and which is useful in the management of weight loss. But more than medicines, what works the best in weight loss is the Rutucharya and Dinacharya. And trust me, it has worked wonders with lot many cases of weight loss.
And even somebody is asking about diabetes. What I would like to ask is not just the diabetes, but any lifestyle disorder. How you can control, lifestyle disorders like diabetes, or maybe heart disorder, kidney disorder.
Yeah.
Is there any?
Now, as the name suggests, it is a lifestyle disease. So something what your lifestyle is bringing in along with it. So you need to actually first study your lifestyle. You need to understand where it is going wrong. So
Exactly.
a lot many times it has to do a lot with very simple things, but it has a huge effect on your lifestyle, like sleeping on time, getting up on time, exercising daily, eating on time, eating in limited quantity, eating only when you are hungry. Okay. Now, again, I mentioned about the Dikshit diet and intermittent fasting, where they say that you don't have to eat for 17 hours at a stretch, and then there has to be a gap of 18 hours, 8 hours. Now, they say that even during this period, if you are hungry, try and avoid food. Where we have observed that such kind of, again, it is a method of apatarpan, where in there are treatments in Ayurveda where we make sure that a patient is not being advised to eat food till he feels that he's going to faint or he cannot manage with his hunger. That is a time when his digestive power is going to go up, you know. So in diabetes, again, diabetes, weight gain, these are the diseases which happen because of santarpan, is overeating. So even in Ayurveda, with a treatment of diabetes, they have said that to eat something which is pre-digested food. Okay, so they talk about the gaon or the bajri, where you make the cow eat that gehu, and then you actually strain that from the cow dung and then make a roti out of it and eat it. They have suggested that patients of diabetes should actually work, and actually they should dig well, they should construct dams, they should construct walls, so where physical laborers jobs are incorporated in your daily schedule, and that's how the sugar levels are going to come down.
Yeah, so that means the physical activity is very, very important.
Very, very important.
Yeah. And somebody has a question there about whether they can have ghee and oil for the heart patient.
Yes, I would like to answer those two questions. How many jalebis at one point of time for migraine? It's one jalebi and a glass of a warm milk on it. That's it. Not two or three. Only one jalebi. The second question is that can heart patients and cholesterol patients consume ghee? They can certainly consume ghee, but mind you, it has to be home prepared ghee. I do not advocate the brands which are available in the market. A home prepared ghee is the best to consume. A spoonful of ghee is always good, where it has got a lot of antioxidant properties, and mind you, it has properties which can have your immunity going up, your skin complexion improving, your circulation improving.
Okay, any other questions that we can take?
There's one question. If keloid is painful, then is there any medicine to reduce it?
The unfortunate part is, there are no medicines for the keloids, but yes, there is one drug in Ayurveda named as Kanchanar Gugulu, which is given for any kind of irregular growth. So keloid is also an irregular growth on your skin surface. So you can consume Kanchanar Gugulu because the Gugul has analgesic properties. So it's going to reduce the pain, and Kanchanar can work over the growth of these keloids.
I think Murtaza is asking one question repeatedly about nasal bleeding.
Sorry?
Okay. Nasal bleeding.
Nasal bleeding, yes.
Yeah. What is it due to? And he's asking the remedy or Ayurvedic treatment for this. I think he's having it for past 3 years. That's what he's mentioned.
Yes. So Murtaza, I'm sure if you check your body composition, there is a lot of heat trapped in your body, number one. Number second is, it is even observed that during seasonal changes, when the body heat goes up, it is observed that these kind of epistaxis is observed in a lot of patients. There is a medicine in Ayurveda which is known as Anantamul or Sariva. It is considered to be very effective against epistaxis. And other medicines include Kamdudha, Suchekhar. Again, certain medicines which is going to bring down the heat in your body can be very effective against the nasal bleeding.
Okay, somebody is asking about, I think, fissures and fistula.
Yeah, and fissura. Adequate fluids, veggies, as well as exercising. Again, I would want this gentleman to look at his digestive system and specifically about the liver and specifically about the bowel timings and the nature of the feces, because many times when your feces are pretty hard, you have to strain and exert, and that is a time when you're going to have piles. And again, the fistula happens because of the heat encircled around your anal region. So please check on all these points what I've mentioned. And yes, there is a treatment in Ayurveda which is known as a Kshara Sutra treatment, where a thread with Ayurvedic medicine is tied along with the fistula, and that results into complete cure of fistula.
Okay, somebody is asking about sinusitis. Sinus problem.
Sinusitis, yes, sinus represents itself in many conditions, and it represents a lot even with pitta dosh and vata dosh also. So for effective treatment of sinuses, along with your medicine goes your rutucharya. More than dinacharya, excuse me, one needs to look into minute details of rutucharya, because many times there is a predisposing factor because of atmospheric changes which initiates sinusitis. So if they look into their rutucharya, I'm sure they can find answers to it. Yes, there are certain medicines which are very effective against sinusitis. Again, steam inhalation and gargling is a very common line of treatment. But in Ayurveda, in Panchakarma, you have Nasya, you have Kavala, Gandusha, which are the effective treatments against sinuses.
Okay. Are there any questions?
No, ma'am.
Yeah, I'm sure we will be. Okay, there is one question there.
Yeah, benefits of yogurt.
Yeah.
Yes. Again, to be very precise, it is Ayurveda believes in one concept of sanskaro hi gunantara dhanam. So when you have sanskar on certain anything, the properties of that properties change in that thing. So a milk, when gets into the form of curd, has different qualities. It does not possess only the qualities of milk. When they talk about yogurt for stomach ache or stomach problems, again, it is, I'm sure you guys are biochemistry students and disciples. I'm sure you have found out that there is this good bacteria, probiotic, and dahi is very high on probiotic this thing, and it increases the digestive process. But according to Ayurveda, dahi is very good for our health, but consumption of dahi in the night can be a problem, which can give rise to many other diseases. So consumption of yogurt in daytime is advisable. Again, that too, it depends on different seasons. Many times it is recommended that instead of yogurt, you're supposed to have buttermilk, which is thin buttermilk, which is very good for your digestive system. So if it is used in a right way and in right quantity, it can be very beneficial for your health.
Now here I would like to add something. You are saying it's not good in the night time.
Yes,
okay.
yes.
I have heard from somewhere, when I used to go for my yoga classes, I had done my yoga with Nikam Guruji in Thane. Okay, so I remember Guruji is no more, but when he was there, he used to tell us that you should not have anything white. Maybe it is rice or dahi or whatever, which is white in color in the
Yes, yes, yes,
night. So
yes.
how it is connected? I mean,
If
what
you see
exactly
all the
happens?
white, yes, if you see all the white food items,
Hmm.
they have lot many processes happening.
Okay.
It's a processed food. So if you take sugar, if you take rice, if you take salt, it's all processed.
Hmm. Okay.
And any kind of processed food in the night tries and blocks your systems, because your strotasas or your systems are working at a very minimalistic level during the night time. So absorption and digestion of such food items becomes prolonged, and that induces apachit aharas, which is known as armor, in your body. And because
Okay.
of which you might experience lethargy, you might experience changes in your digestive system over a period of time. And that's why it's not recommended.
There is one question on, I could not read that
Yeah,
properly.
I suffer from recurrent fever all the time. I feel fever all the time and runny nose simultaneously with red, burning eyes and head pain. Can you suggest me some medical treatment or medicine, because condition becomes worse sometimes? Yes, this has to do a lot with your immunity. This has to do a lot with your pitta dosh. This has to do a lot with your urdhvaga pitta. So the best part, the advice what I can recommend to Ruxar is you have to actually be very, very specific with your daily routine. Avoid garam masalas, avoid green chilies, avoid processed food as far as possible. Avoid fried food, again, because it is very guru gunatmak, and it takes a lot of time for digestion. And to be very precise, Giloy is a medicine of choice which can give you very good result with these conditions.
We are definitely going to share, your visiting card with the students later, so that whenever they have anything, they can get back to you, and I'm sure
Sure,
you would help them. Okay.
sure,
So
sure.
yeah, I know that. I'm quite sure about that.
Thank you so
So
much.
thank you so much for coming. And always you keep coming, and we also definitely get a lot of information. Every time we call you, we get something new, and that is the thing. And that's why we keep calling you, and you keep coming to us. So thank you so
Thank you
much
so much.
for
Thank you so much.
accepting our invitation, years after year. And please keep coming and enlightening us about all these things. I think there are lots of things to be discussed, and every time we have the set of new questions, so many questions. And that means people really are having so much problems. Okay. And health is really a wealth which this pandemic, has made all of us to focus now on our health. And that is a good part of, there are some positives which have come out of this pandemic also, along with
Yes.
the negative. And I think this is one of it. So we have
Yeah.
started taking care of ourselves. So self care is something which
Yes.
this pandemic has taught us. So thank you,
Yes.
doctor. Thank you so much
Thank
for
you so
coming.
much.
And
Thank you so much.
please keep coming. And we will,
Thank you so much.
whatever questions we have, we can always share with you. Please answer them.
Sure.
And we will
Anytime.
share your visiting card with the people whoever interested, so that they
Sure.
can contact you.
Sure.
Okay.
Sure.
Thank you.
Thank you so
Thank you
much.
for coming.
Thank
Yeah.
you. Bye bye.
Bye. Bye.
Thank you so much, sir, for answering these questions patiently. And thank you, Saima ma'am, for conducting the question and answer session. Now,
Thank you
I
so
would
much.
like to call upon Mr. Ronak Anand to give a vote of thanks for our first speaker.
Thank you, Siddharth. I, on behalf of the Department of Biochemistry, KJ Somaya College, would like to extend my heartfelt gratitude to Dr. Chetan for sharing such valuable knowledge with us regarding Ayurveda today. As you rightly said, sir, prevention is better than cure, and disease-free person does have a better longevity, especially in the current times. It is the need of the hour, sir. Your thoughts have really enlightened us. Thank you for being with us today and sharing your thoughts.
Thank you so much.
I proudly would like to say that my entire sessions are getting conducted by my student. That is something I wanted, because I want them to be the ambassadors of all this knowledge in future. I'm very happy that they are conducting in a very nice way. Okay, so yeah. So thank you once again for coming.
Thank you so much. Thank you so
Yeah.
much. Yeah.
Yeah.
Bye-bye.
Bye.
Thank you. Now let us take the event further, and for it I would like to call upon again Ms. Astha Vyas to introduce our second speaker for the day.
Very good afternoon to everyone once again. Our second speaker of the day is Dr. Sushma Sunavne, ma'am. She is a professor and head of the department psychiatry at Topawala National Medical College and BYL Nair Hospital. Dr. Sushma completed her MBBS and MD in psychiatry from Grant Medical College and Sir JJ Group of Hospital. Her area of interest is women's mental health issues. She has publicated number of publications in national and international journals and have contributed chapters in number of books. Now I hand over the rest of the session to you, ma'am.
There is a little correction there. It's Topiwala Nair Medical Hospital. Okay, a little correction
Yes.
there.
Sorry, so sorry, ma'am.
No, it's
Yeah,
okay.
that's okay. That's okay. It's a complicated name, actually.
Welcome to you, ma'am. Formal welcome has already done my students, and from my side, thanks for coming here, of course. And I'm looking forward. You have to have enthusiastic lecture, which we always have from you. So welcome to you.
Thank you. Thank you very much. Is my screen visible?
Yeah, it is.
Yes.
Okay. Okay. So good afternoon, everybody. And thank you for inviting me to give this lecture. It's always a pleasure to come to my alma mater and give a lecture. I actually did my 11th and 12th at Somaya Hospital. That was way back in, I think, 1982, 83. So that's quite a few decades back, actually. And so let's start. My presentation is stress and de-stress. So what is stress? I think everybody of us, after going through 2 years and the 3rd year running of COVID-19, knows what stress is. All that I'm hoping to do right now is to try and put it in an organized way and just help us remember what to do when we suffer from stress, which seems to be happening on an everyday basis. Because COVID started in 2020, early 2020. We were hoping it would end by the end of 2020. It continued in 21, and now we have begun in 2022, and we are facing the 3rd wave now. So what is stress? So stress is basically our body's response to any event that needs attention or has to be looked into. So this stress can be physical, it can be mental, it can be emotional, and can be experienced as a strain. So is stress something that is not good, or is it always a bad thing? No, actually stress is common. It is a good thing to have, because without stress, then we are not really going to work at our highest potential. For example, if we do not stress about exams, if we do not worry about our performance, then we are not likely to take any hard work or work on our exams and try and get good, whatever results. So stress is actually not a bad thing. It is when it becomes distress and it distresses us that stress is difficult to handle. And we find that we are overwhelmed with anything that is stressing us out, any event that is causing us to distress. So I'm going to talk on stress, distress, and de-stress. Okay. So let's go on to what are the causes of stress. Okay, so of course, as I've been mentioning, the first cause of stress, one second, just a second. One second. Screen parakal. Okay. So of course, the topmost, this is pandemic. Now, actually, if you just, pandemic is just one word, but then this is going to cover up all the different causes that causes us stress. Okay. So just the fact that it has run for 3 years and we are still suffering from it is one good enough reason. The first is medical. Any illness, be it a physical illness or a mental illness, is going to stress us out. Now, we humans are social animals. We need to have people around us and we need to be in the company of other people. This pandemic of COVID-19 has really hit on that one core being of us, and that is being social, because this was one illness where patients had to be isolated. In fact, during the acute phase where you have to really need support, you have to stay separate, you have to isolate. Your near and dear ones cannot come near you. In fact, even the doctors and nurses who were looking after you had to be covered in PPE. So you cannot make out that the person you can barely make out that the person is human. You can't make out it's a male, it's a female, it's a doctor, it's a nurse. They all look the same to you. So this pandemic has really hit that thing of being a social animal and has closed us off during the most vulnerable times, that is when we are sick. There have been instances when people have died all alone because the families were quarantined, they were unable to come. So that has really been a really painful time when they have been sick, when people have been dying. So pandemic has really medically caused a lot of stress. The next is, of course, work. Work is always a stress, can be a stress. And especially in pandemic, it has changed the way that we are looking at work. Those who had work were really lucky. Many people have lost work. They have lost their jobs. We all know all this. And people had to change the way they work because many of us had to work from home. Now, luckily for frontline workers, I would say we were lucky. For doctors, for police, for the other frontline people, I would say we were lucky because we could get out of the house and we could mix with people and we could still do our work. The people who had to work from home, I think really were a stressed lot, because they had to combine two areas of their life. One was the work environment and the second was the home environment. So you had to do your work sitting at your home. That means increasing these stressors at home along with your stressors at workplace. So for example, you had people working at home, maybe 2 or 3 people working at home. You had 2 or 3 children working from home, that is schooling from home. Then you had your aged parents, aged relatives at home. So you had these 2 or 3 different things going on together during work in pandemic also. So that has added to the stress in general. Money again is, and it's a very important asset. it definitely makes a big difference if you have money. They say it makes your sadness much better if you have a lot of money. So money is definitely one thing that adds to your stress. So people who have lost their jobs or who have had to cut down on their jobs have faced a lot of financial problems in this pandemic. Okay, we Asians, we all know we are tigers where it comes to education. For us, education is extremely important, and that in a way is a good thing. I'm not saying it's a wrong thing, but then I think sometimes we tend to overdo it, and we do stress out our children much more where education is concerned. So education, for example, we have these big milestones of 10th standard exams and the 12th standard exams, and we really put a lot of pressure on these children. In the pandemic, what has happened is that education came indoors and children had to use technology. The teachers had to use technology. The children picked up faster, I think, than the teachers picked it up, which is as usual, the youngsters pick up technology very fast. But then there were problems where if there were 2 children, 3 children at home, they did not have so many laptops or mobile phones or smartphones which they could use for their studies, and many of them did lose out on schooling due to these problems. So that is another point of stress. In fact, now in the last 2-3 years, so that means we have one generation of students who have not seen the inside of a school actually. And there was this one generation which has passed their 10th standard and now going to give their 12th standard, and it's been actually quite distressing for them. I think the good point was for those students who were not so good and they were worried whether they would pass or would not pass, have managed to pass very nicely, and they are happy. The students who do very well and were very competitive, I think they found it very difficult to see that, they could not go and give their exams, their board exams, the 10th standard, the 12th standard, and really, show their potential in these exams. So the next stressful factor is, of course, relationships. And this does not mean only romantic relationships. Of course, having problems in your love life definitely becomes a stressor, but relationships encompass everything: interpersonal relationships between spouse, partners, parents, children, the other family which you have around you can also add to these stressors, especially in the pandemic when there was a lockdown and people had to stay in. There were more people sitting at home at the same point in time, which in a way did increase their time that they were spending together, definitely. But then also the excess time they were spending together, I think, led to a lot of friction. And there have definitely been more cases of abuse also on the rise, which we have seen in the pandemic. So this was again another thing which was can lead to being distressful. Of course, the other in general ones are if you have any legal problems, which usually tend to be long standing, and these are some things which do not get resolved within a few days or few weeks or few months. This may take years together, and that is what may cause stress and distress. These are the general factors, like, which can add to your distress in general. For example, you have noise pollution, you have air pollution. The one thing, pollution, in fact, during the pandemic did definitely come down, because there were less number of vehicles going around, less number of people outside, many industries had closed down. So actually, the pollution that you saw definitely came down. And it was definitely a pleasure, traveling in our trains when the trains finally did start. It was really a pleasure traveling in those trains. Now, of course, the crowds have again started and Bombay is slowly going back to its normal thing. It is nice to see that also. Now, what could be symptoms of stress? Now, when I mean symptoms of stress, I mean symptoms of distress. That means the stress that you cannot handle and you feel you're getting overwhelmed with the problem that you have in hand. So let's go on to the symptoms. Very often, if you find it's distressing, you start getting irritable, you start getting angry, you start losing your temper for small things, and you tend to snap at people, and in general, make a nuisance of yourself. Then you also start feeling helpless, you feel overwhelmed, you feel hopeless, you feel I cannot do anything. How am I going to manage? This problem is so big. It's definitely, I am also worthless and there's no future. So you start feeling emotionally overwhelmed with these stressors. There can be a lot of pain. There can be physical pain. So you may have a headache, you may have generalized body ache, somebody will come up with pain in the back, pain in the neck. Many headaches are also tension headaches, and these are usually because of stresses and strains. Many people do lose their sleep, so they have insomnia, some of them lose appetite, or some of them can oversleep and overeat also. When we are stressed out, actually, we start concentrating less and we start forgetting more. So you feel that, I am getting more forgetful. I cannot remember things. I had so many things to do, but I keep forgetting them. So forgetfulness and lack of concentration can be one of the symptoms of being under stress or being distressed. We all have our own ways of coping. So let's look into what are the unhealthy ways of coping with stress, and then we'll come on to the healthy ways of coping with stress. The first thing is use of psychoactive substances. So very often people start smoking, they use a lot of oral chewable tobacco, drinking, people go on taking cannabis. Now you have all sorts of psychoactive substances, you have opioids, you have stimulants. So the moment people start getting distressed, they may start taking making use of this of these psychoactive substances, which will definitely be actually more harmful than helpful. So we have our Devdas, where he continues drinking because he does not get the lady of his dreams. Then the other thing is, we may sit in one place, lack of exercise, we will overeat, or then use a lot of watching TV or increased screen time instead of being on our way, exercising, doing our activities and eating healthy food. The other may be pill popping. So for example, so I am having a headache, my headache is giving me problem because I cannot concentrate, so I'm going to pop a pill. I have a backache or I am unable to concentrate, I'm going to pop a pill, and this is usually done without the doctor's advice, and that can be very harmful because very often you do not know what are the long-term consequences of taking over-the-counter pills. This can definitely be very harmful in the long run. The other thing that we do is, when we feel overwhelmed, is we just close on into ourselves, and we feel that nobody can help me. There's no way, I can find anything out of it. Best is that I don't talk to anybody, I don't say anything to anybody, just let me be miserable by myself, and you close off yourself from other avenues of help. This is not really going to be very good for you. The other thing is, as we get more irritable, we start picking up fights with other people and cause even more harm to our interpersonal relationships. Now let's go on to what can we do? What can we make our stress not go into distress? So what can we do to de-stress? Let's see what are the healthy ways of doing that. Okay, now humans as such, we are very resilient. Actually, we adjust and we know how to manage with our stressors. So I am very hopeful. I think that we do not give ourselves that much how can I put it? We don't trust ourselves that we can get over our problems, but believe me, we can, and we are quite resilient. Look at ourselves doing in the last 3 years. We have still managed, and I think we are going to be coming out fighting out of this pandemic. Now, for resilience, 3 things are most important. Is our active coping styles. So coping is not only coping with the problem, it is also coping with our emotions. So there are 2 things about coping: coping with our emotions and coping with the problem. Then is our cognitive flexibility. This basically means that all our experiences, all our past, whatever good and bad experiences we have had, and all that we have learned from it, how do we use it to solve our problems? So our cognitive flexibility is again important. And the last thing is our social support. How much of social support do we have? What is the quality of our social support? That is again going to be extremely important to decide how resilient we are and how are we going to bounce back after going through these hardships. Okay, so let's see what are the options of coping with stress in a very positive manner. Now, not all of us are the same. Not all of us use the same techniques to fight with these stressors. We have different techniques, and we do better with some techniques. Some people do better with the other techniques. Now, as we all know, we have 3 options. We have either we can fight, we can fly, we can take flight, or that means run away from the situation, or we just freeze sometimes when we come across a situation. So let's see how we can use all these 3 techniques to de-stress. First, let's take with fight. So basically, it's not the stress that kills us. It is a reaction to it. It is when we get overwhelmed with the thought that I will not be able to manage this stress is what actually kills us and what actually gives us so much of pain. So what are the methods that we can use to fight with our stressors? So basically, you have to face the problem. You know that this is a problem, and you have to acknowledge that there is a problem. You have to acknowledge the emotions that you have because of the problem, and then get to thinking around ways of fighting this problem or dealing with the problem. So think of different options. What are the plans? Is there a plan A, plan B, plan C? What are the different pros and cons of all these plans? What do you think is going to be the best plan? And then you have to execute the plan. Now, one of your fighting techniques is to be fighting fit. So this means you have to be fighting fit physically as well as emotionally and cognitively. So you can stay fit physically by, of course, all the exercises. You can take walks, you can join gyms. Actually, there's no need to join gyms. You can stay physically fit by various other methods. But then whatever you like, you can choose to stay physically fit. Similarly, as you want to stay fit physically, you should also be fit cognitively. That means using our brains. As we age, our brain is supposed to shrink and our neurons are supposed to die. Actually, that is not what happens. There is a process called as neuroplasticity, where our neurons continue making connections even as we age. And these connections are what are going to keep us cognitively fit. And these connections are made when you use your brains or you use your capabilities, capacities throughout your life. So they say ki, as you age, in fact, you should be using more of your cognitive skills. So you should involve yourself in solving puzzles. You have sudokus, you have various numerical games, you have those word puzzles, you have the new thing called Wordle now. They also say taking up a new hobby, learning a new art, maybe music, maybe just some playing the guitar or something like that, maybe singing. They also say learning a new language makes a big difference in keeping you cognitively fit. The second option is taking flight. So you run and hide. Now like our department is psychiatry, and on the same floor we have the other department, which is pediatrics. So this was before I joined the Nair, of course, when I was in Sion Hospital. So the pediatric HOD would always tell my HOD then, ki, you have too many rooms, you don't need so many rooms. Give me that one room so I can run my afternoon OPD there. And my HOD would really not like to share that room, and you get a little territorial, but he would not be able to say no to her. So he would try not to engage with her in any conversations. The moment he saw her from far, the first thing he would do is take another route and avoid her completely. So in that sense, he would take flight and avoid the interaction completely and avoid that stress completely. You can do that also. There's no harm in doing that. So you can avoid things which are going to cause you stress, definitely. And the other thing is learn to say no. What I mean to say by saying that, please say no. In any office, you will find some person who's very hardworking. And the poor person always gets work piled on to him or her by people around, maybe her or his friends, his colleagues, who will keep saying, "Arey, chota sa hai, ye kar do na." Somebody else will come and say, "Just this once, please do it. I'm not well," or whatever. So that person finds it very difficult to say no, to be assertive, and then they get overwhelmed with work. And so the importance of saying no is to be assertive and assert what you want or what you do not want also. We have to learn to say no also. So you have to run. So where do you run? You run home. Obviously your own home, not to somebody else's home. Run to your own spouse, your parents, sisters, relatives, neighbors. Basically, you go to your social support system, whoever you think is your social support, who you think is going to give you a patient hearing. They may not be able to help you with your problem, but just the fact that you talk to them and you can share with them and maybe get their perspective on the problem will help you, in the sense that it may change your perspective of the problem. Because very often in problems, what we tend to do is we tend to react and not respond. So it is more like a knee-jerk reaction rather than thinking over the idea, going over the problem and coming up with some solution. So running home to your social support system definitely works out. You can go to your family doctor, a counselor, you can come to us psychiatrists also, so that you get a new look at the problem. Freeze. The last is freeze. You can just freeze. Actually, what I mean to say by this is take out time for yourself. That is something I think in our life we somewhere tend to stop thinking actively about. All the time we are thinking about, my work, my family, my children, my parents, my this, my that, completely ignoring me, myself. And that I think is extremely important and something that you should not be ignoring. So freeze, be still. Take out that half an hour, 1 hour from your daily routine. Anyhow, does not matter how. You take out some of your responsibilities, but take out time for yourself to just be with yourself. Just sit. I'm not even saying that you meditate. Maybe initially you will find it difficult to meditate. Just be still and try and be with yourself, just to be with yourself. But there is no more responsibility than that. You can practice yoga, you can practice meditation. If you are the religious sort, please pray. Whatever works for you. If spirituality works for you, you can do that. If you cannot be in nature, there is something called as positive imagery. We use this very often with our patients. We ask them to imagine a place which is your safe place, or where you can relax. So very often, for some it will be the house, for someone it will be the beach, for someone it will be the mountains, for someone it will be like a forest. Whatever it is, you imagine you are in that place, and that is what is going to give you a lot of peace. That is something called as positive imagery, and if you try it, I think it gives you a lot of relief. Having coffee, having tea, if not in excess, is an excellent thing to do. Basically, when you get overwhelmed, what you have to do is just sit back, take a glass of warm water, tea, coffee, whatever your drink is, apart from alcohol and psychoactive substances, of course. You can have this just to give you some time. Okay. Now, what we have to stop doing is being judgmental. Very often we are extremely judgmental. We are not only judgmental about others, definitely about others, but we also tend to be very hard on ourselves, that I have to be this, I have to do this, I have to complete this, I have to see that everything is fine. I think somewhere we have to stop expecting too much from ourselves also, and too much from others also, and learn to be a little more forgiving, and learn to forget many things. We have to choose our battles. Not every battle is important. So be very specific, choose your battles so that you're reserving your energy and stressing less. Okay, now every day, I think everybody of us, now all of us, everybody of us has mobile phones. Once a day, what are we doing? Very religiously, morning or afternoon or evening, we are charging our phones. We never forget to do that. Maybe twice a day also we will charge our phones. Forgetting the fact that sleep is very much a charging for ourselves. Unless we sleep for a period of maybe 6 hours to 10 hours, depending on an individual necessity, you need those amount of good sleep for you to be charged to take on the world the next day. So please remember, charging yourself and getting sleep is extremely important. Now that we are staying in, we have smartphones in our hands, which are constantly there with us. And we have everything, all the information is at the tip of our hands. We can watch Netflix at home. We have so many channels, you can binge. All this is affecting our sleep. So even if you feel sleepy, you just want to complete that one episode, and then we lose out on our sleep for whatever reason. That should not be done. We should charge ourselves just as we charge everything else. Time management. This is extremely important. Many people say, I don't have time, I do not find time to do this, I do not find time to do that, I don't know how I will take time for myself. I think if you follow time management, if you plan properly, and if you prioritize properly, if you know what is your priority,
Participants, please note that there is a technical error on the speaker's end, so kindly give us some time for resuming. Thank you. Participants, please note that there is a technical error on our speaker's end, so kindly give us a little time to resume for the same. Thank you.
Ketan, you can just check with ma'am. Sonavne ma'am. Just call her and check with her.
Yes, ma'am.
Sushma ma'am is trying to reconnect. Kindly bear a moment.
Saima and Hina, I think you can circulate the feedback form till then.
Yes,
By
ma'am.
the time,
Yes,
that would be a better idea that let them fill the feedback form by the time ma'am can join, so that
Can
we
you
don't
hear
waste
me?
anybody's time.
Can you hear me?
Yeah, ma'am.
Yes, ma'am. We can hear you.
Okay, you can hear me. Okay, that's good.
Yeah.
Let me, yeah, my video, I'm unable to start my video because the
That's
host has stopped it.
Okay. Ketan, please.
Ma'am, you can start your video. Now I have made you co-host.
Okay.
Yeah, we can see you, ma'am.
Yeah, I'll just share my screen.
Yeah. Screen is also visible.
Yeah, okay. I'm so sorry about that.
That's okay, ma'am.
Okay, so watch comedies. Okay, let's, as I said, for resilience, having social interactions and your social networking is so extremely important. So try and spend as much time with your family as possible. Spending time with pets is again a great way of de-stressing. Nothing like that to have a pet who gives you unconditional positive regard, believe me, which no other human gives. Excepting animals, you will not get it from anybody else. That is unconditional positive regard. They will love you no matter what you are, what you do, how you look, does not matter to them. So they are excellent de-stressors. Again, take walks. Exercise is one of the most underrated antidepressants. Along with our medications, one of the things that we tell people to do to overcome depression is to exercise. So take walks, whatever ways you want to exercise in is definitely going to help you. If with all this you still feel that you are unable to cope, no harm in it. There is no shame in saying that I am unable to cope and I need to go to a doctor. When your blood sugars go high, when your blood pressure goes high, you definitely go to a doctor. So when you feel stressed, you feel strained, you are unable to cope emotionally, there is no harm in going to doctors. So you can definitely visit us. That is OPD 13 at Nair Hospital. We are there on all days, Mondays to Saturdays. You all are definitely welcome. It's not necessary that we'll catch you and give you only medications. Definitely, we also listen to you. So do not worry about us, trying to just give you only medications. We also do a lot of counseling and therapy. So you can definitely visit us. And thank you very much. So sorry for those glitches that we had in between. And thank you.
Thank you very much, Sunavne ma'am. It was a wonderful session at 3 p.m. in the afternoon. It was real a stress buster session. Now the session is open for the question answer session. So participant, please drop in your question in the chat box. There are a couple of questions, ma'am. We can start with them. So the first question, ma'am, is why is mental health still considered a taboo?
Okay. Yeah. It's a very sad thing to say. I'm really, it is painful to say this, yes. That, when a person gets diabetes or a person gets hypertension, nobody tells them, "Arey, be strong. You have to be strong. How come you got diabetes? How did you get diabetes?" Nobody asks them that. They take it as a matter of fact. Okay, you have diabetes, you have to do this, that, and those things. But if a person becomes depressed or has mania or has psychosis, people just assume that there is a fault in that person and you are to blame for it. This is a mindset that we have to change, and we have to let people know we are not responsible for our mental illness. It is there, it is a part of us, just like diabetes is, hypertension is. If you get cox, that is TB, any of the infections, you cannot help it. So this mindset has definitely to change, that mental illness is such a big taboo, you cannot talk about it. Because people look at it as a weakness rather than a disorder.
Very true, very true. Ma'am, the next question is what should be one's approach toward mental health if they are subjects of childhood trauma?
See, if you have childhood trauma, definitely there are studies which say when you have faced trauma in your childhood, you are likely to face problems in your adulthood. Anxiety, depression is known. Best thing to do is seek help for it.
Ma'am, any coping tips for the highly sensitive people?
Okay, now highly sensitive people. Okay, so now, we have something called as traits, personality traits. All of us have them. Some of them have it in less quantity, some of them have it in a more quantity, some of them are highly sensitive. So we have therapies for them also. And there are specific therapies for specific personality traits, and we have to undergo counseling for that. And we do have therapy for that. There are many medications also which will help you become a little, that highly sensitized thing does come down with medications also.
Ma'am, how does getting bullied affect one's mind?
mind? Okay, see, as I've said, stress affects people differently. So if I get, say, for example, if a person A gets bullied and he decides that I'm not going to get bullied, I'm going to give back. Very often the person who is bullying are usually cowards. If you give it back to them, they will definitely back off. So it is not that they will not, that you cannot overcome bullying. So, but another person may be the introverted types, he's a little anxious, so he cannot face that person who's bullying you, and then they get stressed. So if you cannot fight it out yourself, what I would suggest is that you please talk to your seniors, talk to your parents, talk to your teachers. Now there are counselors in school. Take somebody's help if you feel that you cannot fight the bullying. Definitely you should need help. You should not suffer anybody.
Definitely. Yeah, definitely talking always helps.
Yes, always.
Yes.
Because you will see somebody, you'll get somebody's help, you'll see somebody else's way of coping with that, which you, when you are overwhelmed, you will not think of it. So that is extremely important.
Question from my end. Nowadays, since last 2.5 years, we are continuously working online. So there are various physical stress and the stress on eye because of this constant screen watching and working on laptop with your only this, and it is totally on a laptop nowadays. Earlier we had that computer and mouse. Abhi wo chote se mouse pad pe you keep on working. So personally, I have this stress in this finger and on my eyes.
Okay, now
before you answer, I would like to add little more to Hina's question. I think Hina, you said screen, laptop screen, but ma'am, many of the times, we don't get the laptop also because there is some problem or the other. So constantly, I think we are focusing on the cell.
Yes, cell phone, a small screen. Okay. Yes, right.
Yeah, and whatever she's saying is really very important, because I recently got my number check and the retina scan done and all these things, because I was not able to see without specs anything. And they have found out that my number has been so vastly increased. It may be because of this stress. So what she's saying, not just the laptop screen, but I think it's still smaller screen than that.
I completely agree with you. What has happened is that our gadgets have become smart. So everything has become smart, including our phone. And we are the ones who have not actually become smart. We have become unsmart, frankly, to tell you the truth. So what you have to is take frequent breaks. So try and take breaks. So even these smartphones will have, they'll give you a notification about how much screen time you've had. So in a day, in a week, you'll get that warning that you've been watching your screen for so long. So that is one way in which you can be aware of how much screen time you have. Where it comes to work, you have no option. Okay, but the problem is even our entertainment has become something that we are depending on smart gadgets. Okay, for example, we are watching serials, YouTubes, Netflix, or all kinds of movies has gone on to smart gadgets. In fact, even the social media is another problem. You have more friends on Facebook than you have friends in real life, actually. So the gadgets are becoming smart and we are not becoming smart. It has become something like that.
Yeah.
So just be aware, take a break every 1 hour, I feel. Now you have these smart watches. They tell you after an hour you can get up. Please get up and take a walk.
Yeah.
So you can do something like that.
Yeah. Before this, we said that talking, sharing is definitely helpful. But there are people who are telling that in case when we try to talk, we try to share the people don't understand us, they misunderstand us, or they're not ready to understand our situation. How to tackle those situations?
So find the right person to talk to. Do not find a person who is going to give you that kind of an answer. So you have to choose very wisely. So the quality of your social relationships is equally important. Not only the size, the quality of it is equally important. See, it happens. Maybe some people do not understand what you're trying to say. I'm not saying that there's a fault in them. I'm saying that not everybody is trained to listen and to give advice. So if you feel that people in your social circle is unable to understand you, please come to counselors. That is the best thing I think you can do. Don't expect that everybody will understand you in the way you expect to be understood. Then best is to go to counselors, to come to psychiatrists, and definitely we will be able to talk to you and understand you, definitely.
Somebody is asking
Ma'am,
about
if someone,
serotonin.
Yeah.
yeah. So there's a question: are goosebumps serotonin rush? What are goosebumps serotonin rush?
What was that? What is the question? I would like to take the suicide one. That is extremely important.
Yeah.
Okay, that's an extremely important, a very good question. If somebody is talking about suicide, you absolutely should listen to the person and take it seriously. Many times people say ki when a dog barks, it's not going to bite. Not at all true. Definitely not true. So if a person is talking about suicide, please listen to that person, take it seriously. If you can manage to talk to the person, counsel the person, well and good. If you feel you cannot, the person is still distressed, best thing to do is please seek professional help. That is the most important thing you can ever do to that person.
Yes, definitely. Any more questions from anyone?
Yeah.
Okay, now
There is a
sometimes
question from Nidhi. I think she's asking you how to
how
deal with
to
the stress due to loss of somebody,
okay.
If your dear ones, if you lose.
Okay, so so basically grief, how to handle grief. Grief is something that we will face sometime or the other in our life, and definitely in the last 2-3 years, in the second wave, we have seen many people losing their lives. We have lost a lot of our loved ones, and we are definitely going to go through that. Grieving is a normal process, and it is going to take its own time. Grieving means that you are going to hurt because you have lost a loved one. There is no way you can stop it, or somebody can just say, "Arey, why are you crying?" This, that. If the person wants to cry, let them cry. Crying is not a bad thing. It is an excellent way in which to release your emotions. So if you see somebody crying, please allow them to cry. Don't tell them don't cry. I agree that it distresses you to see somebody close to you cry because it seems painful, but it is an excellent way to release your emotions. So please allow that person to cry. If the person wants to share something about their lost ones, their loved lost ones, please allow them to talk. Talking again is going to be a very cathartic experience for them. And grieving is a process. It is going to take time. Some may take 2 months, some may take 4 months, some may take a year. However it is, it will take some time. And over time, the pain will come down. What you have to do is just be there, listen to them, and support your friend as much as you can. What are the symptoms of ADHD? Okay, ADHD is attention deficit hyperactivity disorder. So basically, when the child, when you start putting a child to school, so first standard, second standard, you'll start seeing that the child is unable to sit, does not sit in one place, keeps moving around. While the teacher is teaching, also the child finds it difficult to sit. So if he's forced to sit, he's going to squirm in his place. So a very disruptive child because he is hyperactive and unable to concentrate. So you're going to see something like that. Adults do have, a few adults, 1% of adults will have a remnant of this ADHD, because over a period of time, naturally ADHD symptoms do reduce even on their own if you don't treat it also.
Okay.
Ma'am, currently society is grieving for losses of social interaction and regularly family get together. Yeah, very true.
Yes,
Dr.
very
Rekha.
true. But then again, I think we adjust. We are really resilient. I must say that no matter what, yes, we have seen anxiety increasing, we have seen depression increasing, but compared to what could have really happened, we are still managing. We are putting our smart gadgets to good use. We are using them to
Right, you बहुत ज़्यादा आवाज आ रहा है. Please धीरे कर दो.
we can make video calls, we can call our friends, we can call our relatives, we can make calls across the world now at any point in time and feel close to them. So definitely, though there is a physical distancing, we can definitely be close to each other in different ways.
There is one question, madam, regarding anxiety. How to deal with anxiety? How to tackle anxiety?
Okay, see now, anxiety is our goosebumps, a serotonin rush. Okay, just let me okay, goosebumps in the sense, you mean to say if you are fearful or something? Is that what they mean? They'll have to, I think, give a little more details about that. There is nothing like serotonin causing goosebumps or anything like that. It is basically it is not going to be one neurotransmitter causing one particular action. It is going to be multiple neuroreceptors, multiple neurocircuits, which will be involved in many of these things. So it's not like you get a goosebump, it is because of serotonin. It is not like that. Okay, now anxiety disorders. Anxiety is a broad term, basically. You have many other disorders in it. So depending on the disorders, there are various treatments and therapies for them. So it's a very broad term when you use anxiety. But of course, in general, you can use yoga, you can use meditation, positive imagery, muscle relaxation. We can do all these to reduce your anxiety symptoms.
Ma'am, how does one know if they are having anxiety issues?
Okay. See, when you are feeling anxious, something that is overwhelming you, many times people have this panic attack. For example, whether they think about something or they don't think about something, all of a sudden your heart starts racing, you start breathing heavily, and you start shaking, you start sweating, and that is when you feel that anxious state. That is when you know that you're feeling anxious or you're constantly worried. Small things also make you worry a lot. For example, suppose I have to go to college tomorrow. So how will I go to college? Will I be able to get the train? Will I go by bus? Will I reach in time? Will my work be done? Will the teacher say something to me? We don't usually think of all these things, right? So when you have all these kind of thoughts in your mind about small things, be sure that you are worrying excessively.
Ma'am, is it not overthinking?
Yes, it is overthinking. Yes, it is. And that is why it causes so many problems for us.
Yeah.
Overthinking is
next question, how to deal with this overthinking?
So, okay, understand that it is overthinking. Once you realize your emotions, that's exactly what you have to do is be aware of your emotions and be aware of what the problem is. Then half your battle is won.
Murtaza is asking some question.
Yes, as a student, how to reduce anxiety before exams?
Okay, see, some amount of anxiety has to be there before exam, because if you are not anxious, definitely you're not going to give your 100% to studying. Suppose somebody told you you have no exams but you have to study. Are you going to study? I would not. For sure, I am not going to study. So you have to have some anxiety for you to work towards giving your exams. And it should not go to a certain extent that now it freezes you and you decide, now I cannot study, mujhse kuch hone wala nahi hai, main fail hi hone wala hu. That should not happen. To reduce that, what you have to do is you have to organize. That means you decide this is the day. So maybe 6 months ago, 3 months before your exams, you organize, you prioritize. What is going to be which is my weak subject, which is my strong subject, how much time does this subject need, how much time will I need to do this much studies. You have to organize that and then put that plan in action. If you ask me 2 days prior to exams, I have not studied this, now how do I reduce my anxiety? That is going to be a little difficult. So this has to start way before your exams. Then your exams are going to get easier. But then we all have our different levels of anxiety. For example, in MBBS, we were a batch of 13, 14 girls, we would all study together, and we all would be very anxious. We all have that. Anxiety hota hai ki are paper kaisa aayega, will we know, jo chapter choda hai usme se long question aaya to kya karenge, how do we do this, that. We all be almost chewing our nails. It happens. There would be one girl in our batch who would nicely aram se have a bath, nicely dress up, then she would sit with an apple, literally an apple, and she's chewing on the apple while we are all sweating. And we would get so mad. It means that also stressed us out. How is she not stressing out? Actually. So it is just an individual thing. Know what your level of anxiety is good for you, is what I would say. Not having no anxiety is no. You see, some anxieties you also enjoy. Now, when we think, what anxiety we used to have then, that is also a phase of life. And it's enjoyable. Don't think all anxiety is bad.
There is one question on OCD.
With OCD?
What was that? Okay, to cope up.
How to deal with OCD?
OCD, okay. Now, OCD is obsessive compulsive disorder. Now, that you need to see a psychiatrist. There is no two ways about it.
Okay, and PTSD. Somebody
PTSD,
is asking.
Okay, PTSD. Okay, you guys know a lot of disorders. Let me say that.
They are biochemists, no, ma'am.
Oh, okay. So they have PTSD about their exams and everything looks like. Okay, so again, PTSD. Okay, no, PTSD can be severe. It is basically post-traumatic stress disorder. And if the trauma is severe enough, the anxiety disorder can be really severe. So yes, I think best is to seek professional help if it gets difficult. Yes.
There is one question on reopening of the school. Hina, just can you read?
Yes.
The reopening of schools increase anxiety in children. We'll see. Okay. Okay. Now there are two sides to this. Okay. Children who are social, they're going to love that the school is opening. Children who have social anxiety, where they find it difficult to mingle with other students, or who are scared of teachers, authority anxiety, they are the ones who are going to be anxious about schools opening. Believe me, the happiest lot is going to be the parents. They'll be so happy that the schools are opening. So yeah, some children are happy.
Somebody was talking to me, I don't remember who now, that the children are fighting in this COVID season. Fighting with each other.
Fighting with each other.
Yeah. So is it related to
It was me.
Oh, I'm so sorry. So
it was me. Tom and Jerry keep on fighting. That's why I agree. I'm waiting for school to reopen and my kids go to school.
That's exactly what I'm saying. If you have confined children in a small space for so long without any avenue to spend their energy, right? So definitely they are frustrated, and they're going to, that physical energy is going to come out some way or the other. That's why I'm saying that we were very lucky. Even during lockdown, we could go out and work. So that really, I think, kept our sanity, definitely. So yeah, being cooped up does, get hard on the children.
Okay. Any other
question? One question we missed was how to deal with the feeling of failure and all.
Okay, that is extremely important. Now, what everybody does, I mean, we all are responsible for it, teachers, parents. When a child does something good, we always praise the child. Okay, but when a child does not do good, there is nothing we do to see that the child gets out of that. And doing, because we continue praising a child doing well, the child expects that he should keep doing well all the time, which is not possible, right? There are going to be times when the child may fail, and you have to build up the child to face those failures also. That is extremely important, I think. That it is not the end of the world. Failing does not mean it is the end of the world. We always tell, parents will say, "Hari, lekin fail ho jayega to kya hoga?" See, why do exams? We have exams coming. We used to have exams every year. Now they have made exams coming every 6 months so that the child does not lose a year. Now, as humans, we live up till what age? Around 80 for sure. With a good lifestyle, we'll live till 80. Suppose you lose out 1 year in school. How does it matter in that 80-year lifespan? Is it so important? Right?
Right.
So that's why I say we as Asians put a lot into studying and passing and, excelling in our studies, which some students cannot manage. And we expect all students to do well in every way, without realizing some children have special qualities, special abilities, and we don't take that into account.
Ma'am, there was a statement or a question. Ma'am, sometimes we feel bad when we get addicted to something, or some people are doing something. Is it really an issue of release of dopamine?
See, again, I'm telling you, it is not any issue about any one neurotransmitter. It does not happen ki dopamine release hoga to you will feel bad or you will feel good. All these neurotransmitters work together in a harmonious way. So you cannot blame any one dopamine or anything. Addictions, you mean to say, is what we call addictions is basically substance use disorder or phone addictions. Now, there are many children who are addicted to the phone. You try to take the phone away from them and they find it extremely difficult. So that is addiction, where the use is to such an extent that it is harmful.
Right.
There is one question from Komal Panchal.
Yeah.
Hina? She's
How
asking
to deal
about
with overthinking?
No, sensitive. She's asking.
Okay, being a sensitive person sometimes can't handle if our near and dear ones show anger or don't listen to us. We feel angry, anxious, and get emotional. How to deal with it? Okay, excellent. The very fact that you realize you are getting angry, anxious, and emotional is a good thing. Now, if your near and dear ones show anger or they do not listen to you, does not mean that you have to it is so distressing to you. If so, for example, if my mom gets angry with me, there has to be a reason why she has got angry with me, or if she does not listen to me, there has to be a reason why she's not listening to me or not agreeing to do what I want her to do, is what I think she's trying to say. That not listening to me is
Correct.
not agreeing to do what she wants to do. So here you'll have to take a seat back and find out what is making the other person angry or not listen to you, and try to find a mid path where the two of you can meet. And that is how you have to deal with it. Try to see the other person's point of view. And it's okay if somebody gets angry. It's okay to feel anxious. It's okay to get emotional. All this is okay. It's not abnormal.
Is it true that good memories fade easily and negative memories remains for more time?
Yes, that is very, very, very true. That is true. You know why? How do we memorize stuff? Tell me that. We memorize stuff by repeating again and again, right? When you have to memorize something, what do? Tables कैसे हम लोग करते थे? बार बार वो पढ़ाई करके हम लोग वो रट्टा मारते थे. So the bad memories also, we do the same thing. What we tend to do is think about it and again think about it. 2 days ke baad again we are thinking about it. 4 days ke baad again we are thinking about it. And what happens is it becomes a nice concrete memory in your brain. The good things we do not memorize all the time, right? We don't try to remove that memory and think over it and all that. We close that chapter. So it is partly our fault, yes.
Any more questions?
Okay.
Ma'am, kids, like my son, he's just 9 years old. He's very sensitive. If I tell him anything harshly, he will start crying. So there are chances as he grows up, his emotions will change, right? Or he will be remaining sensitive. So but like I'm not allowed to say him anything. Otherwise, he will start crying.
So that's okay. So if he cries, what does he say? I mean, what does he feel about it when you tell him something? For example, give me an example actually.
Like today morning only, when we asked him something, that morning when we recite slow, so he was not able to remember that. So my husband just not exactly shouted, but was very strong on him that you have to do it now. It's from very long time you are learning it and you are not still fluent with it. So then he came to me and he started crying. Papa always shout at me. He is always tough at me. So he's right now he's 9, so he's sensitive. But as he grow, he will remain sensitive this way, or he will grow out of this emotion.
See, very likely he is going to grow out of emotion. Very likely he will. Over a period of time, he is going to grow up and he'll learn to handle his emotions well. I think what he's reacting to is the tone of the voice and the expectation, and that you have let me down, you know. He's reacting to that kind of a thing. So you can tell him the same thing in a different way and get the point across. You know.
I explained in that one that we are expecting you to do it nicely. So someone is shouting at you, that doesn't mean we are angry or we want you to do it things nicely.
Yes.
Yeah, ma'am, that's it. Thank you very much. Yes.
If there are no questions, then
yeah, Siddharth, you can take over.
Yeah.
Thank you so much,
there is
ma'am.
Somebody is
Yes,
asking
there is one question in the chat box by Saurav. Just like in dark, we know the importance of light. Are bad memories as important as good memories?
Very good question. Yes. How do we learn? We learn by our experiences. So good experiences, bad experiences, everything teaches us. In fact, the bad experience is going to give you a bigger lesson, which you will learn, you know, remember for a long time. So they are definitely good. You take what you have learned from that and leave the rest of it. Yes, that's an extremely good question.
Thank you so much, ma'am. Thank you so much for answering our questions so patiently. And thank you, Meena, ma'am, for conducting the question and answer session.
Thank you. Thank you for inviting me.
Now, I would like to call Mr. Ronak Anand to give a vote of thanks for our second speaker and an official vote of thanks for the entire Svaasthy Mahotsav.
Thank you once again, Siddharth. Good afternoon, ma'am. I would like to thank Dr. Sushma ma'am for sharing her valuable information regarding the various de-stressing activities. With the pandemic going on, it has affected everyone's mental health in some way or the other, and hence it is very important for a person to relax and de-stress. Your knowledge and mechanisms to relieve stress will surely be beneficial for everyone to cope up with the various problems and have mental and physical peace. Thank you so much for your valuable time, ma'am.
Thank you. Thank you for inviting me.
Thanks for coming, ma'am. You keep coming and we keep calling you. So thank you so much for accepting our invitation every time.
Yeah.
Thank you so much.
My pleasure. Entirely my pleasure.
Yeah. Thanks.
Bye.
Thank you so much, ma'am. Participants, please note that the feedback link is posted in the chat box. The link will be activated for the next 15 minutes. Hence, please fill in the same in the due time. I would also like to bring to everyone's notice that our Department of Biochemistry at KJ Somaya College of Science and Commerce, Club Bio Rangers, present you Health Fair 2022, an event which is based on smart and healthy food choices. It includes the following activities: bio treasure signaling, which is treasure hunt, poster making, nutritional bawarchi, which is recipe making, and logo designing. The registration link for the same is posted in the chat box. See you all in large numbers. Thank you. Now,
and there is a workshop also, Siddharth.
Yes, and there is
by the chef.
We also will be having a workshop by a chef on the same day, which is Saturday, 29th January. See you all in large numbers.
Yeah,
Thank
so
you.
we can learn few things from the chef himself. Thank you. Yeah.
Now I would request Dr. Hina Shah to please play the national anthem.
Before that, I would like I would like to.
Ma'am, can you give us few time? Yes, Ronak, you may continue.
Yes, Ronak, you may continue.
So I also take this opportunity to propose the vote of thanks to the entire Somaya management team, Principal Ma'am Dr. Pradnya Prabhu, for giving us the opportunity and the platform to conduct this informative session. I thank Dr. Avilash and Dr. Ram, who had joined us on 15th January and shared their knowledge regarding disease prevention and routine skin and health care. I would also like to thank Santosh Kudu sir for helping us with all the technical support for today's session. And thank you to all the audience for patiently listening to the session and for posting excellent questions for the discussion. Thank you.
Good.
Now I request Dr. Hina Shah to kindly play the national anthem. Participants, please stand up for the national anthem. Thank you. Thank you. Thank you so much, Hina ma'am. Participants, also once again, the feedback link, the link for the Health Fair event 2022, which will be happening on the next Saturday, is being posted in the chat box. So see you all in large numbers. It is a request from the teacher. I would now request the teachers, can we end the session for the day?
We will wait for 5 more minutes for people to fill the fitness form, and then
Yes,
we will close down the session.
Yes, ma'am. Sure. Thank you so much.
Okay.
So audience, feedback link is there in the chat box. Please fill in the feedback form. you will get the participant certificate for participating in both the session on last Saturday and this Saturday.